As we move deeper into the body, we can now talk about some of our cutaneous mycoses. These are sometimes called collectively dermatophytosis. So it's a skin. They used to think they were types of plants, so that's why it's basically a plant infection in the skin. But they're not plants, they are fungi. These invade the hair, the skin, the nails, and they can break down keratin. However, they generally don't penetrate below the granular layer of the epidermis, so they're not going to get down into the dermis. The various forms or manifestations of cutaneous mycoses caused by any one of these three different genera are called tinnias or ringworms. So ringworm is not a worm, it's a fungus. And they're classified based on their location. Tinea capitis is the scalp, eyebrows, or eyelashes. Tinea barbae, if you have a beard. Tinea corporis is your smooth skin, basically anywhere else on your body that's not mentioned here. Tinea cruris is found in the groin. We sometimes call this jock itch. Tinea pedis of the foot, athlete's foot. Tinea unguenum of the nails, sometimes called onychomycosis. These are the hardest ones to get rid of, the nail infections. These infections can be geophilic. Basically, you got it from the ground or the soil. They can be zoophilic. You got it from an animal. Or they can be anthropophilic. You got it from another person. The anthropophilic tend to cause chronic, non-inflammatory infections. That's how they're able to pass from person to person to person because they're not being treated. They have evolved more to associate with humans. The others can cause more inflammatory lesions because they more accidentally get into people. So here we've got capitis in the scalp, barbae in the beard. We've got the soft tissue or the soft skin. Here's a really significant case of jock itch. It's horrible. Athlete's foot, and then a pretty wicked nail infection. These are most often diagnosed by clinical presentation. You can diagnose them via microscopy, so a skin scraping. It'll show fungal hyphae. Cultures can be done 7 to 28 days. I've actually never heard of anyone getting cultures done for like jock itch or athlete's foot. For the most part, it's a topical therapy. You can actually get most of these over the counter. So for jock itch and athlete's foot, you use the same thing. Those antifungals like tinactin, right? Tough-acting tinactin. You don't even need to go to the doctor. If it doesn't clear up, you might. If you have this infection in your hair or your nails, in that case, you might want to actually do oral therapy. The problem with the fungal infection of the nails is that it's not on the surface of the nail, it's in the nail bed. So it's where the nail meets the skin. So these are really difficult to treat. And sometimes in order to get rid of them, it can be surgical removal of the infected area, which is about as gross as it sounds, removing the nail. And intensive oral and lacquer therapy, like a medicated nail polish almost, as the nail grows back. So if the nail infection won't clear up, the treatment is significant. I'm not going to ask you what they look like under the microscope, but each of the different genera looks a little bit different under the microscope. So if you wanted to know, or if your physician wanted to know specifically which fungal genera was causing the infection, that's how they could do it, was via microscopy. And here is going to be a case study of tinea capitis, or a scalp manifestation in an 87-year-old woman. She had a 2-year history of pruritic, painful, scaling scalp eruption and hair loss. Previous treatment included numerous courses of antibiotics and prednisone without success. Prednisone is a steroid to help reduce inflammation. Of interest in her social history was that she had recently acquired several stray cats that she kept inside her home. I'm feeling very seen right now. On physical examination, there were numerous pustules throughout the scalp, diffuse erythema, crusting, and scale extending to the neck. There was extremely sparse scalp hair and prominent posterior cervical swelling in the lymph nodes. So cervical is like back of the neck, right? She had no nail pitting. Examination of the scalp produced negative findings. A skin biopsy and fungal, bacterial, and viral cultures were obtained. Bacterial culture grew a rare Enterococcus species. Viral culture showed no growth. Scalp biopsy revealed an endothrix dermatophyte infection. The culture was one of the trichophytans. The patient was treated with an antifungal, oral therapy, and a shampoo. When seen at 2-week follow-up, she demonstrated new hair growth and resolution of her pustular eruption. With the brisk clinical response and culture growth of the trichophyton, treatment with the antifungal was continued for 8 weeks. Scalp hair grew back normally without permanent alopecia, so no hair loss. Adults who have hair loss require evaluation for tinea capitis, including fungal cultures. The bacterial infection was likely a result of scratching or itching because of the fungal infection on the scalp. So again, these infections can be more significant than just irritating or itchy. And she likely acquired the infection from her cats. So this is likely a zoophilic strain or species of fungus.